Hi, good evening, Devendra. Good evening, Rajiv. Good evening, Poojan. Hello. Good evening, Devendra. I'm going to talk about important areas which have been asked in the previous year's exams, PYQs, and we'll discuss the areas that we should know of some of the drugs. There are a lot of drugs, but the important ones we'll be taking up in different live sessions. So I'm keeping few drugs for today's session. Alright, let me start with the session of today. And so these are the most frequently asked adverse effects, whether it's a university exam or the previous year, the NEET PG or all. So these are the questions which have been asked. So these are the areas which you should know from those important drugs. So that is the whole focus of these sessions. I'll be doing 2 or 3 sessions on focusing on these adverse effects which you should know. So I'll be putting forward, there are few MCQs which have been asked. So along with the MCQs, we'll be discussing those particular areas and slightly more important things about that particular drug, what extra areas that you should be knowing about them. That's the whole focus, right? So the first question, which was like, we are going to, would you please suggest me best books? I will. I guess, tell me just later on, you remind me and I will discuss definitely. Pharmacology के लिए I will definitely suggest for if theory you want, because GPAT is all about MCQs, so there is already a book present in the market which has all the previous year GPAT questions. So you can do that. But yes, detail wise you have to textbook. But MCQ based is your previous year MCQs are always best at the end, towards the end. When you don't have time, you have to follow those previous year papers. Text के लिए it should be the initial time when you have theory, details theory, but towards the end you won't have time for that detailed textbook reading. But so therefore use previous year questions and then retrograde reading should be there. Detail basis is Tripathi or Sharma, both of them, any of them. Yes, Tripathi, some people like Tripathi and some like Sharma. They are equally good. Both of them are equally good. MD Pharmacology, they would need, apart from these 2 basics, you would require to have Katzung, you would require to have Goodman-Gilman and Rangendale. Rangendale is mostly pertaining to figures and all, but Katzung and Goodman-Gilman. Many topics you won't find in Tripathi or in the Sharma because that is mostly undergraduate based. But for a postgraduate student, you have to have, that is definitely there. You need to know Tripathi and Sharma in and out. But apart from that, you would need extra. and extra would come from the books like Goodman-Gilman and Cadson. Both are good. GABA receptors, yes, they are important for the mechanism of benzodiazepines and barbiturates. So first, let's stick to today's topic, which is your must-know ADRs in pharmacology. And let's start with the first MCQ, and that is, this is very common, right? Captopril can cause all except. Captopril can cause all except decrease in potassium concentration, decrease in the afterload, proteinuria, or blood dyscrasia. So what is the correct option? Captopril can cause all except decrease in the potassium concentration, decrease in the afterload, proteinuria, blood dyscrasia. So which of the following ADRs is not seen with captopril? Yes. Can anybody answer? Which of the following ADRs is not seen with captopril? Decrease in potassium concentration, decrease in the afterload, proteinuria, or blood dyscrasia? Which we cannot see with captopril? Yes, anybody? Blood dyscrasia. Okay, Rajiv says blood dyscrasia. Anybody else? Careful, you have to be careful with when we are studying the options. Decrease in the potassium concentration, decrease in the afterload, proteinuria, blood dyscrasia, which is not seen with captopril. Okay, I will repeat. Captopril can cause all except option 1 is decrease in the potassium concentration, option 2 is decrease in the afterload, option 3 is proteinuria, option 4 is blood dyscrasia. So which of the following adverse effects which I have told you are not seen with captopril? I hope you know it is a ACE inhibitor. So ACE inhibitors में कौन सा option is not, or which ADR is not seen with ACE inhibitors? Chronic kidney disease and losartan. Losartan nahi hai, losartan is an ARB. Okay. Captopril can cause all except, so ACE inhibitors actually they cause hyperkalemia, not hypokalemia. So the correct option is option number 1, decrease in the potassium concentration. Because ACE inhibitors cause increase in the potassium concentration. So not decrease. So the correct option is option number 1. Now what are the important ADRs of ACE inhibitors that you should be knowing? Because this is one of the ADRs. There are many other ADRs which are also asked in the exams. So what you do is remember a mnemonic, captopril. Easy. Remember the spelling of captopril. C-A-P. I'll tell you, blood dyscrasia will tell you what it means actually. C-A-P-T-O-P-R-I-L. Right? So C is for the cough. You know that ACE inhibitors are notorious to cause dry, brassy cough. Second is angioedema. So ACE inhibitors can cause angioedema. Many a times questions have been asked, they have posted or they have given you a picture of swollen lips and they ask you which of the drugs causes that. So it's an angioedema. So it causes angioedema. P stands for proteinuria. T stands for taste disturbance. Taste disturbance, or we can call it as dysgeusia. So taste disturbance is caused. O stands for orthostatic hypotension. Now this primarily is a side effect seen with captopril only, not with the other ACE inhibitors, because captopril is a very short acting, very fast onset of action, very short acting drug. So immediately drops the BP. So patient can have orthostatic hypotension seen with captopril. Then PRIL. P stands for in pregnancy. Absolutely contraindicated because it is teratogenic. R stands for it can cause renal failure in patients with bilateral renal artery stenosis. I stands for increase in the potassium levels, and last L will stands for, if you see in the books, it is given that it can lead to in certain patients low granulocytes. So blood dyscrasias will come in that. So low granulocyte levels has been also seen with this drug. It is given in the textbooks. So that's why I say ki when you're preparing, when you have time, please go through the textbooks. All these things are written in the textbook, but sometimes we overlook them. So it is not that common a side effect, but it is there. But out of all this, the startling जो मैंने options दिए थे, the most probable or most correct option would be that I had told you it causes decrease in the potassium levels, but it causes hyperkalemia. So remember the captopril mnemonic, and you remember all the ADRs with ACE inhibitors. So ACE inhibitors is very, very important to know for whether it is your entrance exam or whether it is your university level exam. Also, another thing about captopril, you should know that this is, along with this drug is not a pro-drug. So most of your ACE inhibitors are pro-drugs, but captopril is not a pro-drug, right? This is also asked, which of this is not a pro-drug? So perindopril, captopril, they're not pro-drugs. Please remember that, right? All right, let's go to the other second question. And again, it is regarding the ADR of a different group of drugs. So please listen carefully. Thiazide diuretic does not cause hypercalcemia, hypomagnesemia, hyperkalemia, hyperuricemia. Again, I will repeat. Thiazide diuretic does not cause hypercalcemia, hypomagnesemia, hyperkalemia or hyperuricemia. Thiazides क्या नहीं cause करते? So diuretics are again a very important topic when it comes to the MCQs on their adverse effects, whether it is a loop or whether it is a thiazide. You should know the difference in the adverse effects of both of them. There is one major difference. I'll be discussing it. That's why I put this question. Thiazide diuretic does not cause. Yes, anybody? What do you think will be the correct option? It does not cause hypercalcemia, hypomagnesemia, hyperkalemia या hyperuricemia. Thiazides क्या नहीं cause करते? Yes? Any guesses? Or if you know this very well, अगर नहीं आता, just guess. Hyperkalemia. Very good. Very good, Samuel. Lakhan says hyperuricemia. Okay. Does not cause hyperkalemia? Yeah, does not cause. Yes. My question is does not cause. Yes, does not cause hyperkalemia. Yes, absolutely correct. So Jay and Samuel, you're absolutely correct. Thiazides do not cause hyperkalemia. Rather, this group of drug causes hypokalemia. Now, so I will tell you the trick. No, it causes hypomagnesemia. So now I'll tell you a trick how to remember. So what you do is, first you remember the adverse effects of loop diuretics. They're almost similar to thiazides, और एक difference है. I'll tell you how to remember that difference. So loop diuretics, high, what do they increase? So high, so remember the mnemonic glue, G-L-U, glue. Glue is always high, it becomes sticky, so remember diuretics. So glue remember करना है G-L-U, high के लिए. क्या high करते हैं, क्या increase करते हैं? G is for glycemia. So loop diuretics cause hyperglycemia. L say they cause dyslipidemia or hyperlipidemia, and U stands for increase in the uric acid levels. So loop diuretics will cause high in the glue. G, hyperglycemia, hyperlipidemia and hyperuricemia. ये है high. अब low क्या करते हैं? So low के लिए mnemonic है PMC. ठीक है, PMC. Low करते हैं potassium, P for potassium, or you can say hypokalemia. P is for potassium, low potassium. M is magnesium, low magnesium. C is for calcium, low calcium. This is for loop diuretics, high glue, low PMC. Okay, so PMC is low and glue is high. Now, the difference in the loop and the diuretics. So, all these side effects are seen even in the diuretics except for one. So, can anybody tell me what is that one difference between loop and thiazides? Very important again, because the question is asked on this difference only sometimes. What one out of them, GLU, PMC, only one difference is there between. Everything else is the same between loop, diuretics and thiazides except for one. Which ion? किस ion में difference है? Hypo और hyper में between the loop and the thiazides. Any guesses? Even if you don't know, just guess. Which ion? The levels of the ion are different, whether when we talk about loop diuretics or when we talk about thiazides. Only one. The rest are all the same. Everything is the same. Only one ion. Sodium, no, they both will decrease because they are diuretics, so they will both decrease sodium ions. So sodium to hai na, because that is what diuretics. Which ion ke increase ya dyslipidemia? No, it is seen with both. Any other guess? Okay, I'll tell you. It is the calcium. Please remember, this is very important to remember. Or agar somebody is preparing for PG, it's potassium both cause hypokalemia. Yes, very good. Calcium. Calcium का difference है between loop and thiazides. Loop diuretics हमने अभी किया कि hypocalcemia करते, but जो thiazides है, they cause hypercalcemia. Please remember, this is very important difference. Loop diuretics cause hypocalcemia and thiazides cause hypercalcemia. So, how to remember which causes hypocalcemia and which causes hypercalcemia? Because the rest of differences is same. So, how to remember this? Which causes hypocalcemia and which causes hypercalcemia? So, hypo में O आता है. You know, in hypo there is an O. So, which of the diuretic has O in the spelling? Loop has a O in the spelling. So, LOOP होता है ना. So, O, hypo. So, loop causes hypocalcemia. So, definitely thiazides cause hypercalcemia. Or if you even remember the mnemonic I told you, glue and PMC. So, because calcium का ही difference है. So, remember only calcium is different. Thiazides cause hypercalcemia and loop causes hypo. So this is a very important difference because it has been asked in the previous year questions in the MCQs also that which of these causes hypercalcemia. So usme thiazides answer hota hai. So remember that for this, right? Another thing I'll tell you, bonus tip I'll give you. Sometimes there is a question asked on the site of action of these diuretics. So how to remember the site of action of the diuretics? You just remember the structure of the nephron. कि पहले आता है PCT, then it is the loop, then it is the DCT, and then it is the last में collecting duct. And remember another mnemonic I'll give you, clots. CLOTS, clots. So remember, if you remember this mnemonic, this is how the diuretics are going to act. So first is C. C stands for carbonic anhydrase inhibitor. So first one, they will act in the proximal convoluted tubule. L stands for loop diuretic, so they will act in the loop only because loop ही उनके नाम में है, so they act in the ascending loop of Henle. O stands for osmotic diuretics. Now their major site is loop as well as in PCT, but loop में इनका main site है, so osmotic also work in the loop. Then comes clots में T stands for thiazides. So thiazides act in the distal convoluted tubule. And then S stands for spironolactone, you can remember, which acts at the collecting duct. So this is how you remember the site of action also of the various diuretics. Because abhi, I think last FMG maybe they had shown a picture of the nephron and they had put the site of action of thiazides over there in the DCT. So remember this way, clots agar aap yaad rakhoge, so usi order mein from PCT to CD. I'll remember. I said how to remember the site of action of various diuretics. So starting from the PCT till the collecting duct. कैसे याद रखोगे? Yes, I am doing it. Starting from the proximal convoluted tubule, because पहले आता है proximal convoluted tubule, then loop of Henle, then distal convoluted tubule, and then it is your collecting duct. So आपके diuretics कहाँ कहाँ act करेंगे? So to remember them, remember the mnemonic of clots. CLOTS. C stands for carbonic anhydrase inhibitors. ठीक है? So first आ गया वो. So first हमारा है proximal convoluted tubule. So they act on the proximal convoluted tubule. Then is your L. L stands for loop diuretics. So they act in the loop of Henle, ascending limb of the loop of Henle. Then is your O, osmotic diuretics. So their primary action is also in the loop and they also act in the PCT, but primary action would be there in the loop. Then is T. T stands for thiazides. So third part aa gaya aapka distal convoluted tubule. So thiazides act on the distal convoluted tubule. S. S stands for spironolactone. Spironolactone is the last end में, in the collecting duct it acts. So this is how you remember the sequence of where the diuretics act in that nephron. PCT से लेकर collecting duct तक आप ये clots का mnemonic याद रखो and you will never forget which diuretic acts on what part of the nephron. Understood? Alright, and also remember I told you the side effects. Loop में क्या side effect का difference है? What is the difference between thiazides? And there are few other ADRs I'm going to talk about, one or two more, which is also important to remember. Let's see this MCQ and third cheese important hai in the ADRs of diuretics. So can you tell me what is the drug which causes deafness out of all these? Which drug causes deafness? Number 1, thiazides. Number 2, spironolactone. Number 3, ethacrynic acid. Number 4, triamterene. Thank you, Samuel. Thank you so much. Yeah, drugs causing the deafness. Drugs causing the deafness is number 1, thiazides. Number 2, spironolactone. Number 3, ethacrynic acid. Number 4, triamterene. Which of these will cause deafness? This is another very important ADR to remember and an MCQ also, which is because all of them I have taken from the previous year MCQs. Nothing I have framed on my own because these have been asked. So I am telling you that these are must know questions for you. Which of the following drugs, जो मैंने 4 drugs बोली है, which of them causes deafness? And there's a very easy way to remember this. Thiazide करता है deafness, spironolactone, ethacrynic acid या triamterene. Which drug causes deafness? Any guesses? Just guess. नहीं आता then also it is fine. आता है तब बहुत अच्छा है. नहीं आता then you will learn. Nothing. There's no loss here. Very good. Ethacrynic acid. Yes, ethacrynic acid is that drug which can cause deafness. Very good, Alhamdulillah. And very good sensitive souls. Both of you. Right. So remember E. इसमें सिर्फ E याद करना है. E for ethacrynic, E for ear. Ear problem. So yes. So this is another ADR to remember. Again, it has been asked many times. So this mnemonic you should know by heart only now. Now, another ADR from the diuretics again. Now, gynecomastia is caused by which drug? Gynecomastia is caused by which drug? So, is it bumetanide? Is it spironolactone? Is it thiazide? Or is it furosemide? Gynecomastia is caused by which drug? Is it bumetanide? Is it spironolactone? Is it thiazide? Is it furosemide? Yeah, this was right. Ethacrynic was the correct answer to the previous. I think there's a lag, so that's why the answers are coming a little later. So now we are on to the next one. Gynecomastia is caused by which drug? Yeah. Gynecomastia is caused by which drug? Bumetanide, spironolactone, thiazides, or furosemide? Another important ADR. Okay, gynecomastia is the enlargement of the male breast. That is what is the term gynecomastia. So it is a side effect seen with certain drugs. But in se, out of all these, which one causes gynecomastia? Bumetanide, spironolactone, thiazide, or furosemide? Very good, Rajiv. It is spironolactone. So remember again, spironolactone causes gynecomastia because of its anti-androgen effect. So therefore, not preferred much because of this. Rather, we have other drugs like eplerenone which don't have the gynecomastia effect. So again, remember, gynecomastia with spironolactone is a very important side effect to know. And ethacrinic acid ke saath ear deafness or deafness as such. And remember those ions side effect. Very, very, very important. Which are increased, which are decreased, what is the major difference between loop and the thiazide diuretics. So this is all about the diuretics part. Most important. Alright, now let's come to the another drug which is very important and normally asked quite a lot in exams. So let's see and look at the question now. All of the following adverse effects of phenytoin. All of the following adverse effects of phenytoin are seen in therapeutic concentrations except. All of the following, please listen to the question very carefully. All of the following are the adverse effects of phenytoin which are seen in therapeutic concentrations except number 1, osteomalacia, number 2, gum hypertrophy, number 3, hirsutism, number 4, diplopia. So all of these are seen as a side effect of phenytoin within their therapeutic concentrations except for one, which is not seen in the therapeutic the side effect doesn't occur in therapeutic concentrations. Whether it is osteomalacia, whether it is gum hypertrophy, whether it is hirsutism or it is diplopia. कौन सा side effect होता तो है इसके साथ but therapeutic concentration में नहीं होता. कौन सा नहीं होता in the therapeutic concentration. So all of them are the side effects of phenytoin, just to tell you. But only one occurs, only one of the side effect will occur when the concentration is beyond therapeutic concentration. बाकी जितने भी हैं they occur within the therapeutic concentration. Hirsutism it occurs within. Prolonged effect है थोड़ी देर के बाद हो सकता है पर it occurs within the therapeutic concentrations only. Hirsutism. Again be ready, I'll give you another mnemonic to remember the phenytoin side effects. But let's see first what all, if you know this. So if you know phenytoin has side effects which is seen in therapeutic concentrations but when used over a prolonged period of time, or it can have side effects when suddenly there is an overdose. Option repeat. Okay. The first is osteomalacia. Second is gum hypertrophy. Third is hirsutism. Fourth is diplopia, which will not occur in therapeutic concentration. Which will not occur in therapeutic concentration. No? Gum hypertrophy, it will also occur in therapeutic concentration. Alright, I'll tell you the answer. The answer is diplopia. Diplopia does not occur in therapeutic concentration. Diplopia, ataxia, hallucination, nystagmus, you will only see when there is an overdose of phenytoin. The patient ने overdose ले लिया है, ज़्यादा tablets ले लिया है, सो नेक्स्ट डे जब पेशेंट आता है डॉक्टर के पास, ऐसे झूमता झूमता आएगा, टैक्सिया हो रहा है उसको, हेलुसिनेशंस हो रहे हैं, डबल विजन, दो चीजें नजर आ रही हैं, ठीक है. And so that occurs only when there is a high concentration of phenytoin being taken by the patient. The other side effects occur when the therapeutic concentration is there, yes, but over a prolonged period of time, these side effects they are equally important. So for the chronic toxicity, so diplopia will occur in acute toxicity, that means high dose, while the other side effects jo the, they will happen over a period of time, that is chronic toxicity. How to remember the side effects of phenytoin of chronic toxicity? Remember the mnemonic high, H-I-G-H, hydantoin. You know, hydantoin is the chemical name for this phenytoin. High hydantoin. So high ka H is for the hypersensitivity reaction. I stands for induces vitamin D metabolism. So it induces vitamin D metabolism. That's why leads to osteomalacia. Another I is interferes with folic acid absorption. Okay, one I is induces vitamin D metabolism causing osteomalacia. Another I is interferes with the folic acid absorption causing megaloblastic anemia. G stands for gum hypertrophy or hyperplasia. Another H stands for hirsutism, increase in the coarse facial hairs, and hyperglycemia. So H has two here, hirsutism and hyperglycemia. और जो high के बाद hydantoin है, that is fetal hydantoin syndrome. तो अगर pregnant female or pregnant lady is taking this phenytoin, fetal hydantoin syndrome occurs, cleft lip and all that kind of features occur in the fetus. So remember the chronic toxicity by the mnemonic of high hydantoin. H is for hypersensitive reactions. I is for increased in the vitamin D metabolism causing osteomalacia. Another I is interferes with the folic acid absorption causing megaloblastic anemia. G stands for gum hypertrophy. Another H stands for hirsutism, hyperglycemia, and hydantoin in the end stands for fetal hydantoin syndrome. So very, very, very important phenytoin. Rather, even the valproic acid ka toxicity is important. So these both have very frequently asked, phenytoin and valproic acid. दोनों बहुत important है in anti-epileptic drugs. All right, let's go to the other question here, and let's go to another important topic. And here I'm going to talk about anti-diabetic here, anti-diabetic drugs. Okay, we'll have this is the last question we'll have about the anti-diabetic drugs. So listen to the question now. Oral hypoglycemic drug, which is less likely, or we can say oral anti-diabetic drug. Rather, hypoglycemic is not the correct term to use nowadays, but there was an MCQ. So we can say oral anti-diabetic drug which is less likely to cause hypoglycemia is options: repaglinide, second option is gliclazide, third option is pioglitazone, fourth option is glimepiride. I'll repeat the question again. Oral hypoglycemic drug or oral anti-diabetic drug which is less likely to cause hypoglycemia is: number 1, repaglinide, number 2, gliclazide, number 3, pioglitazone, and number 4, glimepiride. Which one of these drugs doesn't cause that much of hypoglycemia in the patient? सबसे least tendency to cause hypoglycemia. Yes, let's have the answers. Very, very important. Another important topic, anti-diabetic drugs. I'm not gliclazide. Okay, gliclazide. You know that sulfonylureas are quite notorious to cause hypoglycemia. Sulfonylureas. C. You mean pioglitazone. Hemant means pioglitazone. Okay. Yes, pioglitazone. Very good. Very right. Right, Rajiv. Right, Hemant. So it is pioglitazone. Now, See, remember one thing very clearly. One is insulin, and second is any drug which causes the release of insulin. They will be more prone to cause hypoglycemias. या तो insulin खुद, या any drug which causes the release of insulin. Insulin releasers, they have more tendency to cause hypoglycemia. अब इन ऑप्शंस में से देखो कि इंसुलिन तो नहीं है, बट विच आर द ड्रग्स विच कॉज द रिलीज ऑफ इंसुलिन, राइट? Repaglynide, does it cause the release of insulin? These are meglitinides. Do they cause release of insulin? Yes. Gliclazide and glimepiride, both are sulfonylureas. Do they cause release of insulin? Yes. Left is your pioglitazone. Pioglitazone is a thiazolidine diones. That is PPAR alpha and gamma agonists. So they have the least tendency to cause, out of all of them, they have the least tendency to cause a least risk of hypoglycemia. So pioglitazone has the least risk of this hypoglycemia. Now, out of this group, thiazolidine diones, another two important drugs, जिसके ADRs पूछते हैं, because they have been withdrawn. So why have they been withdrawn? So the first one is troglitazone. So anybody who knows why troglitazone was withdrawn, was banned or withdrawn? Why? So because of certain drugs are there which have been withdrawn, and the reason for withdrawing them is equally important because they have been asked in the exam. So can you tell me why this drug troglitazone was banned or withdrawn? Anybody? No? So troglitazone was withdrawn because it caused liver toxicity. Hepatotoxicity was the reason for withdrawing of. So this is very important to note down that troglitazone was withdrawn because of it caused hepatotoxic effect. Then rosiglitazone, another drug here, because Pio is the only one which is available in India as such. Tro withdraw ho gaya. Rosiglitazone is also withdrawn from India because it increased in certain patients. There was found to be an increase in the risk of myocardial infarction. So because of that, only pioglitazone is one drug which is available for us. Then there are few other areas in the drugs. I'm not discussing insulin here, only the oral antidiabetics, the important ADRs which you should know. So sulfonylureas, agar hum shuru kare from sulfonylureas, so remember the most important is hypoglycemia, that is there. Then because any drug which has sulfur moiety in that will have a risk to cause hypersensitivity reaction. ठीक है? So sulfonylurea है, इसमें भी there is a risk of hypersensitivity reactions. The third ADR to remember for sulfonylurea is weight gain. Weight gain है, that is important ADR to remember. Then another drug which is your chlorpropamide. अब हम first generation use नहीं करते, we don't use them much because second generations are much easier or they are much safer as compared to this, but hypoglycemia still remains. But still, because exams में they sometimes ask you, yes, metformin decreases vitamin B12 levels causing megaloblastic anemia, and because it decreases the absorption of vitamin B12 from the intestine, that's why it causes megaloblastic anemia, and it causes lactic acidosis also. So sulfonylureas, chlorpropamide, it has an antidiuretic like action, so it also causes hyponatremia. That's another thing to remember, and it causes a disulfiram like reaction. So disulfiram like reaction when consumed with alcohol. So this is important to know about sulfonylureas. Metformin, already Rajiv said that it is vitamin B12 deficiency, and number 2, lactic acidosis. Not lactic acidosis, normal लोगों में नहीं करेगा. More prone होते हैं वो लोग like elderly or people who have renal diseases, because they वहाँ पे ये acidosis के chances ज़्यादा होते हैं उनमें. ठीक है? So then what is important is for acarbose. Acarbose like drug जो होती है अल्फा ग्लूकोसाइडेज इनहिबिटर, मेन प्रॉब्लम इज माल अब्जॉर्प्शन. GLP-1 एगोनिस्ट्स या ग्लूटाइड्स जितने भी है, लीराग्लूटाइड एंड ऑल दैट, मेन प्रॉब्लम इज नोजिया, वॉमिटिंग. एंड Another important point जो आजकल जो पूछते हैं MCQ में, liraglutide has also been used for management of obesity. It has been found to decrease the weight. So it also used for management of obesity. Liraglutide approve हो गया है for obesity management. Then talking about gliptins, DPP4 inhibitors, gliptins. Side effect जो important है उसका nasopharyngitis. ठीक है, nasopharyngitis important जो पूछते हैं, and this is asked. And vildagliptin is more prone to cause hepatotoxicity. So please remember these ADRs. Important जो ज़्यादा पूछते हैं, which you should be knowing. Nasopharyngitis with DPP4 inhibitors, vildagliptin causes hepatotoxicity. Then SGLT2 inhibitors, your gliflozins, जितने भी हैं, canagliflozin, ampagliflozins. So इनका जो major side effect है, because what they do is they will increase or they inhibit the absorption of glucose back. So they will cause more glucose release into the urine, और जहां भी glucose जाएगा, that is a seat of infection. So it has tendency to cause urinary tract infections. So quite prone, people who are on SGLT2 inhibitors can develop urinary tract infections, and some cases of risk fractures have also been reported. Right? So these are your major adverse effects. Not all I can discuss, but ये main adverse effects of all these anti-diabetics, which should be on your fingertips. मैं ये नहीं कह रही हूँ याद करो, it should be on your fingertips. ठीक है? न्यूरोपैथी के लिए even vitamin B6 is there, you know, vitamin B12 नहीं है, B6, pyridoxine is more important when it comes to neuropathy वाला. You know, that's why isoniazid, you know, that has a tendency to cause neuropathy because of vitamin pyridoxine. That if you remember the biochemistry, I don't remember the biochemistry that much, but I think B6 is more important here. But yes, all of them, you know, it is not just this one. B12 भी है. B12 ज़्यादा ज़रूरी होता है for the formation of the, in the maturation of the RBCs, right? So इसलिए उसकी deficiency is more prone to cause megaloblastic anemia. ठीक है? I hope Rajiv you got this. Right, so today's session we've discussed these are just a few drugs which I could cover in the one session. There are so many others I'll be taking up in the next sessions also, the other drugs. Still there are a lot of drugs left, jinke ADRs are something that you cannot afford to forget in pharmacology. So we've discussed today for the thiazides, we've discussed today for ACE inhibitors, we've discussed today for the oral anti-diabetic drugs. Yes, so and we discussed for phenytoin, anti-epileptic, very important. Two anti-epileptics के जो side effects सबसे जरूरी है, that is valproic acid, phenytoin. You have to know these ADRs, right? So these are the ones which have been commonly asked also in the exam. So all the reason to know them better, right? So I hope you could get some benefit out of this session today. So ये ADRs more benefit तभी रहेगा if you are preparing for exam or you're appearing for some exam or you're a student of pharmacology. Thank you so much. So keep a notepad always with you when you listen to such sessions, because you tend to forget after the session is over. So if you want to retain them and give them this is most important. Start writing down them down in some of your notebooks or a notepad so that you don't forget. Later on you can copy it, fare it out, but do not miss out on these sessions, because what I've seen many papers in the previous exams, and I could make out that what are the important ADRs. Phenytoin, अच्छा रिपीट कर दूं. ऑलराइट, फेनिटोइन का जो क्रॉनिक के लिए है ADR, इट इज हाइडेंटोइन. ठीक है, हाइडेंटोइन. ओके, आई विल से हाइडेंटोइन में जो फर्स्ट H है, दैट इज योर हाइपर सेंसिटिविटी रिएक्शंस. I इज फॉर दो है I का. फर्स्ट I is for increases the vitamin D or induces the vitamin D metabolism, thus leading to osteomalacia. Second I is it causes interference in the folic acid absorption, causing megaloblastic anemia. G, gum hypertrophy or hyperplasia. Another H, there are two again H इसके लिए. One is your hyperglycemia. Second H is hirsutism. And Hydantoin is as such fetal Hydantoin syndrome. Also, in case you want to, again, listen to this recording, this will be uploaded. So why not at that time, kuch bhul jata hai, so just go through and you can always get back to it, right? One drug band name, there were two I mentioned, troglitazone and rosiglitazone. Troglitazone was banned because of hepatotoxic potential. Rosiglitazone in India especially, it is not available because it was found that increased the risk of myocardial infarction in certain patients. But books write that in US it is still available. They didn't find anything, but India may, it's not, the reason is increases in the potential of the myocardial infarction. So pioglitazone is one of the drugs जो available है, and that is used. It has the least tendency out of all these drugs to cause hypoglycemia. Obviously, अगर आप इसको किसी और ड्रग के साथ कंबाइन कर लोगे like sulfonylureas, तब तो बढ़ेगा ही hypoglycemia. But alone, it is alone if they are used, then it has less risk of causing hypoglycemia. All right, I hope clear now. Still you have any issues, you've missed something, you can just go back and watch the recording once it is uploaded and pick on the important points and keep writing them down. Okay. So next time I am going to come with few more drugs, jinke like even digoxin is left, which is very, very important topic. Lithium, digoxin, they're also very frequently asked. Like especially digoxin, I want to discuss all the side effects which are important for that, the arrhythmias. So all the questions related to digoxin, that is very, very important also. All right. So let's end today's session then. Take care, guys, and have a great, great weekend. And keep studying and enjoying also by side. See you next time. God bless. All right, Rajiv. Very, very good. Sure. All points are clear. Good. All right. Thank you.